have all of you with us because this is really an important conversation around paid family and medical leave and maternal and infant health equity. So our goals really for today are to really share information about the bill, provide an overview, hear from Representative Richardson about her ideas about why this is important and what you hope to accomplish, and really begin to dive in and look at how we can use this bill to address some of the inequities that are experienced in Black, Brown, and Indigenous communities in Minnesota around maternal and infant health. I think the last thing that I just wanted to highlight before turning it over is that we really are looking for some of the strategies that are going on, that you're working on in your spaces and in the work that you've been doing, or if you have others that you want us to connect to around that, I think that would be really helpful. I did just want to alert everybody that we are going to record the meeting. There were a number of people who could not be with us. So we will record the meeting and share a link. I'll put it up on YouTube so that people can access it. So if anyone is concerned about that, please let me know and I'll try we'll limit who has access to the video. But the intent is to share information about the bill and have some strategies that we can take a look at. So what I would like to do is, as Deb had suggested, while we're waiting on some other people and as we get started, if you could introduce yourselves and say who you are here and how you heard about this meeting. And then in the chat box, if you would identify at least one thing that you're hoping that you'll learn from today's meeting, or that you want to cover, that would be really helpful. And I'll try to manage the chat box while we're going. So if you could just briefly introduce yourself, Deborah, why don't we start with you and then we'll move to Representative Richardson.
Sure, thanks. Really excited to be here having this conversation today. As Laura mentioned, my name is Deb Fitzpatrick and I am the Director of Policy and Legislative Affairs for Children's Defense Fund Minnesota. Before coming to CDF about 9 months ago, I was at the University of Minnesota, Humphrey School of Public Affairs, where I led a center working on gender and racial equity, and was the lead researcher for the state of Minnesota on this particular topic back in 2016 when the legislature mandated a study to understand how the state could best implement and design a program. So very excited to be here today. This is an opportune time for this conversation. We're really revisiting every aspect of the bill right now in preparation for 2021. And so really trying to reach out to as many folks as we can to make sure we're getting the details right, because we know that the details are really, really important in terms of who gets to take advantage of this program and whether we'll realize the intended equity benefits. So excited to be here with all of you.
Thank you. Representative Richardson. Yeah.
Hi, good morning, everyone. Thanks for signing on this morning. So I am just finishing up my first term in elected office, and I'm excited to be carrying the paid family leave bill. I see some of the folks from iChirp, so want to say good morning. Before I joined the legislature, I was one of the co-chairs for the iChirp committee, and so it's good to see that they're still doing the really great work that within the prenatal space and looking at birth outcomes. In terms of my hopes and goals for not only the coalition, but just the bill in general, is that we can ensure that there's space and there's a centering of voices of individuals who need paid family leave and have those stories of having to make those tough decisions between caring for oneself or caring for one's family members and work. I've been in that space before. I know what it feels like to be ill. I know what it feels like to have a high-risk pregnancy. And it's like, are you going to work or are you going to take care of yourself? And so I know that there are a lot more stories out there like that. And those are really the powerful stories that we need to center in terms of looking at not only the research-based evidence that tells you how much better infants do when there's paid family leave, and there's a lot of research behind supporting paid family leave, but we also need to have the stories of the individuals who have not realized those benefits. Because so often, if you hear from people who say, thank God I had paid family leave, people are like, well, thank God you had it. We don't need to do anything different because you got what you needed in the space that you needed it in. And we know that that's not the story for every individual. And one of the things that I'm also hoping as part of this bill in terms of being able to work with really diverse coalitions to bring really diverse experiences is to ensure that there are trusted people within the community who can help raise awareness of the work that we're doing right now as we're trying to craft a bill, but also as the bill moves along in the process. And I'm just gonna say it until when it becomes law, because it's gonna become law. I don't know when, but it is. It's gonna become law. And so when it becomes law, that people understand that it is a benefit that they should take and that they know about it, because we can do all of this work and we can create all of these opportunities, but if people don't know they exist, if people don't know how to access it, all it really means is that people who already had enough are probably getting more. And who will be left out are the individuals who likely need it most. And I think as part of that conversation, we need to be thinking through how do we build a bill that also protects people when they need to take leave as well. Because if you still have that fear that I'm going to be fired, or my employer is just going to replace me, that's going to keep people from taking leave as well. So I want to be able to build something that is going to help the individuals who haven't had access to resources. And I also want to ensure that they can have the comfort when taking that leave, that they are not going to be retaliated against or punished for that. So just happy to be in this space with all of you this morning and looking forward to the conversation. I will apologize. I didn't know when this was set that we were going to be called back into session by the governor. So I'm not going to be able to be here the entire time today, but I will stay as long as I can.
Great, thank you so much. We are very excited to have you as the lead author in the bill in the House, and especially with your deep knowledge on maternal and infant health equity. It's a great gift. So thank you for that. So I know that we want to dive into the details of the bill, but if you could just briefly introduce yourself, and then again, just in the question in the box, chat box, sorry, if you would like to list any of the key questions you're hoping that you might get answered today during this session, or we can answer at another time, that would be great. So if you would just briefly, Belay, would you like to introduce yourself?
Yes. My name is Balaya Safa. I'm coming from Ethiopian Orthodox Church, implementing, the Community Solutions Project. And my position is leader and coordinator of the program of early childhood. Yeah, I am interested in this meeting because it says everything what just we are expecting from families, because they have to take care of their loved ones, kids, and so if people know about the benefits of maternal and child care and work, and at the same time get paid for the time spent with their families and taking care of their loved ones, is very crucial, so that the family have time to address the burning issues within the family. So this is a great opportunity for, I think, for us implementing community projects to aware our community deserve this opportunity. Thank you.
Thank you.
Hi, everybody. I'll just introduce myself. How about that? Move it along. I'm Nora Hall. I am one of the consultants that works with the Integrated Care for High-Risk Pregnancies program, which is also known as iChirp. And I'm actually here to listen and figure out where connections can be made that we can bring back to the advisory council.
Thank you. Nancy.
Good morning, I'm Nancy Jost. I work for West Central Initiative out of Fergus Falls, and I'm the co-chair for Prenatal to 3 Coalition, and I'm here to learn. Thank you.
Karen?
Karen Gray, also a consultant with iChirp, and I'm going to try to find Ruth, somebody. I know the name. Oh, you know the name? Georgia Fort. Is this the same bill Georgia was working on? No.
No, this is a different bill. Lori Halverson had this bill previously.
Okay. All right. Anyway, I know the issue because we met with Georgia and she was telling her own personal story as to what happened to her. And she didn't realize she didn't have these benefits until she needed them. And I think that's probably happening for a lot of Black women. You know, you think you have something and you find out when you need it, you don't, or you don't even know what you need. So yes, I'm here to learn and listen. Thank you.
Thank you. Atande.
Hi, everybody. My name is Atande. I help support the PN3 Coalition and also wear some other hats with the help coordinate the Home Visiting Coalition and also the Hennepin County Children's Mental Health Collaborative. Just here to listen, to learn, to hear more from, I think, Deb around what the strategies and the goals are for this upcoming session and where all of us can get plugged into the work.
Thank you. Susan.
She says she has no audio, remember?
Okay, that's right. So if you could put it in the chat, I know you're listening. I put it in the chat. If you would introduce yourself, that would be really helpful. Okay, let's see. Everyone moved on. And Maureen, do you want to go ahead?
Sure. Hi, I'm Maureen O'Connell, and I'm a consultant, and I do policy and legislative work for various nonprofits. And Deb invited me today because I work on paid family medical leave with the coalition for on behalf of Take Action Minnesota. And then I have a particular interest in maternal health and achieving equality for all kids. Thanks. So I'm here to listen too.
Great, thank you. Talia, do you want to go?
Can you hear me?
Yep.
Okay. I don't know what's happening with my camera today. I'm Talia Glass. I work in Congresswoman Omar's district office here in the 5th. And these have been issues that have been priorities for Congresswoman since the beginning. And as Representative Richardson was saying, she's someone who has had personal experience with these issues too. So I'm interested in just listening and hearing what's going on at the state level.
Talia, thank you. All right. Leah, welcome. We are just quickly introducing ourselves and saying where we are, and then we'll move through that so we can get to the overview.
Hi, thank you. You're probably going to hear a first grader in the background, so apologies. My name is Leah Montgomery. I am the lobbyist and main policy person at Planned Parenthood here in Minnesota. serve a lot of patients who face a lot of significant health disparities and are very interested in working more in maternal health issues. We already do work in that, but are always looking to do more. Excuse the noise in the background, so thank you.
Thank you. All right. Andrea, welcome.
Hi, good morning, everyone. My name is Andrea Martinez. I'm the Family Systems Project Manager at CLUS, which is a project aimed to identify what are the main barriers that the Latinx families face to access high-quality services of early care and education. Thank you.
Great. Thank you. And Barty.
Sorry, everybody. I'm having sort of intermittent broadband internet connection, so I can hear you better when I'm off camera. I'm Barty Wahi. I'm the Executive Director of the Children's Defense Fund. It's so good to see many faces that I know. I guess I would just say that I'm here because I think it's a really critical issue. A month after I had my second child, I had to go back to work because I didn't have any sick time. So I both feel this issue personally. And I will also say that last year, CDF did over 50 community listening sessions across the metro area, primarily in various communities of color. And to a listening session, paid family leave came up. And in one session, we had one Somali mother say, hey, even in Somalia, when we had civil war, we had paid family leave. And we don't here. And I was like, point to you, yes. So I do think that we can do so much better in this area, and I'm excited to do that work collectively. And I'm so happy to have Representative Richardson on championing the bill, because she's such a great champion in all spaces. So I'm so glad to be able to move this forward. Thank you.
Great, thank you. All right, so we are having some additional people join us along the way, but I think we should turn our attention, if Summer, welcome. If you could just say who you are here representing, and then we'll turn it over to you, Deb, to provide the overview of the bill. And then I'll place in the chat box right after Summer introduces herself, I will send in, I'll add files to the chat box, but I will also send them to you after we meet. So for those of you who maybe don't know how to take them down from the chat box, I will send them to you after today's meeting. So welcome, Summer.
Thank you. Yes, good morning. I am Summer Johnson. I'm the Chief of Strategic Development at Open Cities Health Center, a federally qualified health center in St. Paul. And I'm also representing ITERP and the Nubian Moms program through Open Cities. So happy to be here. Thank you so much.
Great, thank you. All right, so Deborah, why don't we turn it over to you? I know you have some slides to share as well. So I will put up the meeting materials, some meeting materials for you. So you might have to toggle at the bottom to find them as Deborah shares her slides, okay?
All right, everybody. I'm going to share my screen. We're going through a couple of quick slides. I want to try very hard to reserve a lot of time for conversation, but I thought it might be good for us all to get grounded a little bit in just kind of the cloud level view. And then hopefully we'll have an opportunity to dig into some of the details that I think are really important for, again, this bill to do what we hope it will accomplish. So I'm going to share my screen here with you and get this PowerPoint going here. Slideshow. So thought it might be helpful. Oh, how do I get out of this view? Okay. Okay.
Yes, click that first one. Click that
first one?
No. Display settings and then swap.
Okay, display settings, swap. Okay, thank you. Tande is our tech guru here. All right, excellent. So first of all, just a tiny bit of history on the bill in the state of Minnesota. It was first introduced in 2016 and at that point moved through the Minnesota Senate and was passed by the Minnesota Senate in the omnibus tax bill. Did not make it that year. And then, you know, legislative configuration changed over time. And we were able to get it passed in the Minnesota House. Most recently, last year, it passed the full floor as a standalone bill. We have been lucky in Minnesota to be able to learn from the experiences of 8 other states have now passed a paid family medical leave insurance program. 3 states have had programs in place for a number of years. California, the longest standing one. And most recently, Oregon and Connecticut passed programs. But as time has gone on, the programs have gotten better and better, or the bills, the statutes, as we've been learning from the experiences of the early states. And so the bill that passed the House this last year really is one of the strongest in the country. And it is built on, again, the learnings of other states, in particular in terms of some of the questions about whether the programs actually increase equity or exacerbate disparities. So I think those are important things to consider as we're kind of walking through the bill. So I thought, you know, again, just to level set here, we know that most workers have a need for leave from working in the paid labor force. That's the problem we're trying to solve with this bill. It doesn't solve every problem. There may be some, you know, moms that are stay-at-home moms that aren't part of the paid labor force, et cetera, that have maybe some needs as well. This bill is really designed to help deal with kind of the economic stability of folks who have to be out of the paid labor force for a period of time greater than a week. The idea here is that we're dealing with more serious situations that aren't covered by paid sick time, or, you know, the kind of regular paid time off that many workers get through their employer, although upwards of 40% of workers in Minnesota do not get any paid time off. So important that this program would at least provide some support to those workers who have a need for longer leaves. The most common reason for medical leave in the state programs that exist now is pregnancy recovery and complications. So I think that's really important to note. In general, medical leave is much more prevalent than family leave. As a use of the programs, and then within that medical leave category, pregnancy is the most common reason for leave. We just, in the last couple of weeks, got new data from the US Department of Labor about leave-taking behavior. The 2018 FMLA survey just came out. And it shows that a higher share of employees in single parent households take leave. This is national data now, this is not Minnesota specific, than dual parent households, and that leaves are longer for those single parent households. And a higher share of low wage workers take leave, and those leaves are also longer. And here's some Minnesota specific data. This is, so as part of the work that we've done with the Department of Employment and Economic Development, again, in my work prior at the University of Minnesota, we were able to work with researchers at the national level that have developed a sophisticated simulation model that helps us figure out kind of what might happen in the state of Minnesota or in any particular state if programs of different types are implemented. And what you can see here is that current is kind of, you know, the state of play we're in right now with no paid family medical leave program, how many people at these different family income levels take a FMLA leave of any of the reasons in a year, and how that might change if we had a program like House File 5, which is the bill that passed the Minnesota House last year, in place. So you can see here, currently, lowest income families are less likely to take leave under a program. They become the most likely to be able to take a leave. And we can get into some of the reasons, obviously, that those changes occur, but it's many of the things we've already talked about in our intro section. So And obviously many of these events are really hard to plan for and create economic challenges, both for workers and employers. So we also see that particularly smaller employers struggle with helping their workers, even if they want to. It can be challenging to figure out how to support them, how to come up with the resources that are needed to allow someone to take a long leave, a longer term leave. And, you know, as we've already discussed today, access to adequate paid time off to manage these events are not evenly distributed. And, you know, we see significant variation based on geography, race, income, employer size. And I think it's also important to note that unmet need for leave is also measured in this national survey. And what we see, of course, is that the need to take a leave, but the ability, you know, that you can't take for a variety of reasons, and the number one reason is lack of pay, is higher among single parent households and low wage workers. This is on top of the leaves, of course, that are already being taken. So in the previous slide. So pay while on leave, as I just mentioned, is also less common, 39% compared to 65%, and job loss more common for low wage workers. Only 22% of low-wage workers receive full pay while they're on any of these FMLA leaves, and often those are those shorter-term leaves. The FMLA leaves can be as short as a week, and so, you know, those might be more likely to be fully paid than others, the longer-term ones. And we know from a variety of studies that differential access to paid leave contributes to significant racial disparities, not only in health, but also income and in wealth. When you think about the impact of having to leave your job or lose your job in the middle of one of these events, when you might be facing extreme medical bills and on top of everything else, it really piles up. So, you know, again, there is a huge research base showing the some of the things that can come from having access to pay while on leave. I say can because I think you know, the devil is in the details to some extent in terms of who actually has access to these benefits. And so we'll talk a little bit more about that as we go on. But you can see here there are obviously a lot of pieces to this that are related to infant and maternal health. So just a quick overview of what the kind of big parameters of the program are. It provides up to 12 weeks of partial wage replacement for leave of at least 7 days. So the idea here is this is a leave that is a little bit longer term. And the idea that people can, you know, use other sources to manage those first 7 days. We can talk about that. The program is structured to allow people who don't have any paid time off to get those 7 days back. So once you've achieved the 7-day qualifying event, you can go back and get partial wage replacement for those first 7 days. So just want to be clear about that structure within the bill. So 12 weeks for a worker's own serious health condition, which includes pregnancy, and up to 12 weeks associated with care of a family member. And so that's the kind of bonding leave, but also care for an ill family member, which could be a child, of course, as well. And it's important that in many of the states that have these programs that the benefits are stacked for a birth parent. So a parent giving birth oftentimes qualifies for up to 10 weeks of medical leave for health recovery related to pregnancy. And then on top of that, bonding leave of up to 12 weeks in the case of this bill. All employers are included, and there's also an option for owners or self-employed folks or contractors to join, to opt into the program. We know that's an increasingly large part of the workforce, and are trying hard to make sure we can figure out a way to include those folks in this program if they are interested. And there is a option for employers to offer their own comparable program if they want to. In the states, all of the states that have these programs have this allowance. For the most part, employers realize that it's more beneficial for them to be part of the state program because it is a good deal actually. because of the way risk is spread across the entire population of the state of Minnesota. There are very few companies that choose this option, but it is there. So we have, in order to be eligible for the program, a worker only has to have earned around $3,000 in the previous year. And this is sort of built on the unemployment insurance definition of significant attachment to the workforce. Again, it's any time in the last year, $3,000 from all employers within the state. So relatively low threshold compared to other states. And the wage replacement levels for folks who are out on leave and part of the program are progressive in the sense that the lowest wage workers receive a higher proportion of their wages replaced. 90% of wages are replaced up to an average of $25,000 a year. It's a formula in the law. We don't put any dollar amounts in, so it can move with the economy. I can't see the chat because I'm kind of dealing with the slides here. Laura, feel free to interrupt if there are questions that are coming up that you want to answer in the middle of this or think are important to answer in the middle of this. Otherwise, I'll just keep charging through and we'll come back to questions at the end.
Why don't we take questions at the end, Deb?
Okay. Okay, sounds good. All right, wanted to just kind of like talk about the philosophical way that these programs are structured. And this is the way that programs are structured in 7 of the 8 states that have programs and most of the world as a social insurance program. And that's a kind of different way of thinking about benefits. Usually in the United States context, we're thinking about benefits as being attached to a specific employer. This program is different in that the wage replacement is portable. It's not attached to a specific employer or even to current employment. Again, if a worker has met that $3,000 threshold sometime in the last year, even if they're not currently working, they would be eligible to receive benefits from this program. And the worker is receiving the benefits from the state during this leave, not from their employer. There are a couple of reasons that this is kind of a dominant model that I'll lay out. First of all, by doing so, it really spreads the risk and costs across the whole population. And the way that the costs are borne by this program is split equally between workers and employers. This approach also is less likely to incentivize discrimination than employer mandates, which are a kind of different way of thinking about this, just saying every employer has to offer 12 weeks of leave for their employees. So in that kind of situation, there may be more incentive to say, I don't want to hire people that might take a leave. I don't want to let people take a leave because I'm going to bear the full cost of that. So the idea is by spreading the costs and risks, it's sort of, you know, everybody's in it. It's not just one employer trying to, you know, figure out how to manage the situation on their own and then having to potentially think about who they're hiring and how they're managing that in a way that might discriminate against workers that need to take leave. It's also an earned benefit structure. So the idea that everyone is contributing to the program and that everyone benefits. And these structures tend to be both more politically durable in that there's a broad-based, skin in the game for everybody. And they also tend to be less stigmatizing. So the idea that everyone needs leave, everyone has been paying into this fund, everyone has the right to take advantage of it. Shouldn't use that term. Take advantage of it is a huge issue that we face, right, in terms of who's worthy of these kinds of support. So anyway, and as a state fund also, I think importantly, as opposed to an employer provided benefit, protects worker privacy regarding health or sensitive issues related to families that qualify people for these benefits. So the way the program is structured, workers do not need to reveal those details to their employer. It's part of the claims process. They're notified that a worker has been approved for leave with program benefits, and that's all the information that the employer gets, not, this person is taking a leave for X reason, etc. We can talk more about that too if there are questions. As Representative Richardson mentioned, the employment protections are super important as it relates to these kinds of programs. Those are things like the right to return to your job after your leave, continued health insurance while you're on leave at the same terms as when you were, before you were working, and then anti-retaliation provisions. These provisions are both connected to taking a leave with program benefits, but they obviously, because of what they are also attached to a specific employer. Because of that, there's an additional eligibility for these worker protections that you have to have been with that employer for 90 days. This is obviously significantly less than FMLA. Some of you may know that for FMLA, you have to have been with an employer for a full year at almost 3/4 time. It's one of the biggest reasons that people are not currently eligible for FMLA is this, this piece of it. So also important that the leave under this state program would run concurrently with unpaid leave entitlements under Minnesota's pregnancy and parenting leave law and the federal FMLA. So they're not stacked, like you don't get, the 12 weeks under this program and then an additional 12 weeks under FMLA. We could talk about that as well. That's been a heavily contested area in prior conversations on this bill through the legislature. So wanted to talk real quickly about some of the ways that we've tried to design this program to address equity. I mentioned earlier that we've been learning a lot from what's happened in other states. What are the barriers that people have to access in other states? How are we making sure that this Minnesota program isn't actually, reifying disparities in terms of access? So some of these we've already talked about. I'll go quickly through them. First of all, we have this low earning threshold, and it's across all employers for workers that have multiple employers or variable work histories, etc. And there is no requirement for current connection to an employer. So again, anytime in the last year, $3,000, all employers. Wage replacement is based on the highest earning period in the past year. So I think this is also important for workers that have a variable working history, may have some periods of work where they're, working full-time and others where they're working part-time. The wage replacement, the amount of benefit that you get, is based on your highest earning period in that past year. We have, as I mentioned, some of the strongest employment protection provisions in the country because we have a low eligibility threshold and are basically saying anybody that's eligible for this program for the benefits is eligible for job protection. That 90 days requirement for the job protection is among the shortest in the country as well. The progressive wage replacement ensures that the lowest wage workers receive close to full pay while on leave, which I think is also really critically important in terms of people being able to access it. We have a very expansive definition of family in our bill to include any caregiver designated or anyone living in the same household. So really broad. This is, anybody, and this is really reflective, I think, of all different kinds of family structures and ways that people think about giving and receiving care. I think really, really importantly, as Representative Richardson mentioned, is that a portion of the program revenue, this is unique to the Minnesota bill, is dedicated to ongoing outreach and includes a grant structure for community groups. So I think we know that this there's a big problem with relying on employers to provide information to workers about their benefits under these programs. And yet many of the programs really do require or rely on employers to provide information. We are taking seriously the need to go outside of that to engage all kinds of community folks, people who have trust in the community, people who have relationships in the community, to do the kind of work to make sure that all of Minnesotans are aware of their of this program. There are a lot of notice requirements through employers as well, and it has to be indicated on people's pay stubs so that they know they're paying into the program and things like that. But we know that we're really important to make sure that we have the resources. This is often the part that gets left behind. Like, we have significant resources dedicated to the outreach. And then the final piece I wanted to mention is that we've worked really, really hard to be very thoughtful about the intersection of this program and other public benefits. So making sure that people don't lose access to other benefits such as SNAP, child care assistance, MFIP, other types of support that people may have. If in some other states, it's counted, these benefits are counted as unearned income, which means they're a direct offset to current benefits. And so we've structured it the other way so that that doesn't happen, and been very thoughtful about making sure that people are able to continue to receive all of those benefits as well as the benefits from this program. So I'm going to stop there. That was a lot, a lot. We do have some specific parts of the bill we can dig into, but just wanted to throw it open first to some just broad questions, comments, concerns, things that have been coming up for people as we kind of went through this lot of information there. So
there are a number of questions in the chat box.
Okay.
So if you could, there's two of them around eligibility for documented and undocumented members of family or people who are working. Can you talk about how documentation status is impacted here?
Yeah, so we are working hard. California's done a lot of work to make sure that that documentation status is not a barrier to receiving program benefits. And so we are building off of that. It's not an explicit piece of the bill as it's written now. It's kind of the detail, and that is how DEED would do the claims process and collect wage information. But we recognize that that's a really critically important issue, and that many undocumented workers are paying into these systems and historically and are unable to access them because of the way they're structured. So it's definitely on the radar and part of the way that we structure that that wage piece and who's considered an employer and worker. So absolutely.
Thank you. There's actually a couple more around that. So more specifically, do you need a social security number? And then the other one around that is, can somebody who is a documented worker take leave to care for an undocumented family member?
So the first part is that we were working so that it doesn't require a social security number. We're working to figure out how to do that. And again, California has done some good work around that piece. And then absolutely you can take time off as a work, as a worker yourself, a documented worker, you can take time off to care for a broadly defined family member. The status of that person doesn't matter. It's your status that matters as a as a worker who needs this kind of leave, or somebody with a working history that needs this kind of leave to care for somebody else.
Great. There's also a question in here around, you were referencing 8 different states. Could you identify which 8 states you were talking about?
I can. So the states are, sorry, just getting my list up here so that I can make sure I don't forget anybody. It's California, New Jersey, Rhode Island are the 3 states with the longest running programs. Sorry. And then Washington State, Massachusetts, Connecticut, and Oregon. And DC is often counted as the 8th state, even though they're not really a state. So we say 8 states, but it counts the District of Columbia.
Great. I put them in the chat box as well for people to track that. There was there is another question in here around how does this data intersect with people of color living in rural areas? Does this further exacerbate issues for them?
Well, so we also know that rural workers have less access to family-friendly benefits of all kinds, including paid time off. So the data is, the only data we have on leave taking behavior is the national data that I had mentioned earlier. The simulation models that we run to help us understand how much this program might cost, for example, how many people might use it, et cetera, map that national leave taking behavior onto the Minnesota population. And so we don't have good data at a lot of those disaggregated intersections. There has been some conversation historically about Minnesota collecting its own data on who takes leave and whether they're receiving pay, what kinds of, and if we were to do that at some point, we might have enough data to be able to look at the intersections of some of these different aspects of people's lives. Right now, we do have, in the 2016 study, we were able to document how workers of color across the state, again, not intersecting just with rural, but across the state had less access to paid time off. So I'm not sure that that answered your question. I think that the bottom line is that we know there are definitely disparities currently. I think, again, many of the provisions that I outlined on the last slide are designed to help ensure that we're addressing some of those disparities. I would hope that we would be doing significant outreach in rural communities with the dedicated outreach funding, knowing that that is an issue. So I'm not sure if that answered the question in particular, but I'm happy to do follow-up if there's more.
I think that's helpful. Thank you. There's another question in here, and then, oh, Representative Richardson, would you like to say goodbye before you sign off? I know you have to leave, and we are recording this, so we'll make sure you have access.
Oh, I appreciate the recording, and just thank you to everyone who is interested in this issue and who's stepping up to be an ally through this process. Looking forward to working with all of you. Sorry you have to run. Have a great day, everyone.
Thank you. So there's another question I think that would be helpful, Deb, if you could speak to this, and I think that's part of why we're here today as well, is how long does it take, do we know how long it takes somebody earning minimum wage to earn up to $3,000 compared to someone who is, Nancy suggested up to $25 or more an hour? How equitable is that? And so is the minimum wage a more equitable approach than maybe hours worked or?
Yeah, there has been a lot of conversation about whether a hours worked or a minimum amount of money is, which is more equitable, right? And I think that it is a good point that somebody who's earning more is going to reach that $3,000 threshold more quickly than someone who is earning less. In part, the move away from an hourly calculation comes out of the way the data collection occurs through the Department of Employment and Economic Development for employers. But it's something that certainly could be revisited. I don't have the calculation here, and I don't want to pop off of here to go to Excel, but if somebody, maybe Atande can do that, just take 3,000 and divide it by, I don't know, which level of do we want to go with, $9 or $10? And you get a sense of how many hours. We did do just so that you're, did Nancy ask that question? Yeah. Yes. We did do a calculation. It's like 95% of workers in the state of Minnesota meet that threshold in a given year. So that looking at the kind of wage detail and looking at the American Community Survey on earnings, that it's about 95% of Minnesota workers earn at least 3,000 in a year. So
great. We have responses both from Atande at 300 hours and then Susan also stating minimum wage in Minnesota is $10 an hour. 300 hours or 7.5 hours a week versus 120 hours for 3 weeks.
So Washington State has an hour threshold and theirs is 860 hours, I believe. FMLA is 1,250 hours. So just for comparison, it's a relatively low threshold compared to 820 hours is Washington State, yeah, and FMLA is 1,250.
Great. Okay. Are there any other questions for Deb before we dive into some specific questions that we all have for you? Oh, there's, let's see. Andrea. Oh, okay. Andrea is leaving and we will send you the link. So thank you for joining us. Okay. Any other questions for Deb generally on what she's presented thus far before we move in? Thanks, Nancy.
I think it would be super helpful if people also have like particular examples of situations that you've encountered in your work. We can also sort of think about like how map that person's experience onto the way this is currently structured or maybe some things we hadn't considered that we need to be thinking about in terms of how we structure this. I will say that one of the other challenges is this bill is already about 80 pages long, and there is a lot, so it's complicated. There's no question, it's very complicated. There's also been a lot of discussion about what should be included in statute versus what should be deferred to a rulemaking process. Both have their drawbacks. We want to make sure we have what we need in statute so that no matter who's in power or who's, that we have the basics down in a way that is going to serve our goals. But also it's kind of hard to anticipate every single, thing that will come up. Again, we have the benefit of other states to be learning every single day what things we need to address or they wish they'd addressed or problems or challenges that are coming up. But we know there will still be more of those things that we can't possibly anticipate. So. You're on mute, Laura.
That's a great opportunity for us to consider, and also we could, when we send the recording out to people, we can encourage them to think about situations that they want to better understand if they would qualify. So with that, why don't you go ahead?
I noticed that Barb is on. I want to just say something about tribes, tribal communities, tribal nations would have the ability to opt into the state program. Obviously, we don't have the ability to compel tribes to be part of a state program, but we would, it is our intention to have an explicit section that allows tribal nations to opt into the state program if they're interested. So would love to talk more about that as well at some point, make sure we're understanding what some of the, how we can make sure that that's a legitimate possibility and we're understanding those intersections as best we can.
That's great. Okay, so we have both Barb and Susan who might be able to help us think through that.
Oh yeah, sorry, Susan.
That's okay. You can't see the chat box, so all right. Why don't you go ahead? Oh, Barb, did you want to respond to that, or Susan?
No, I just want to apologize for being late. Had something happen, and it's good news, but got me sidetracked this morning. So
no problem. Thanks.
My apologies
for joining us. And I know, Susan, you are on listen only mode. So if you have anything you want to throw in the, oh, I'm sorry, I missed the statement. She said, the question was, or what, Deborah, do you want to just restate about how tribal governments have to opt in? Do you want to restate that? Susan missed it.
Yeah, just, you know, we are not, you know, we're not allowed to compel tribal nations to be part of this program, but we do want to provide an opportunity for tribal nations to opt into it if they're interested in being part of it. So that would be, you know, something that each nation might want to look at what they get and what the, you know, what they might benefit from. Obviously, enrolled members would be, you know, to the extent that they're out in the paid labor force, they would be eligible for the program like every other worker. But as an employer, tribal nations, you know, would also be able to opt into the program. So.
Great. Okay, why don't we, in the last 25 minutes, turn our attention to the other questions.
Yeah, so I'm just gonna flip through these and we can kind of maybe see where there's some energy, but I wanted to lift up some issues that we'd love to get some feedback on. I think the first one is this, you know, a lot of this program and access to this program hinges on a serious health condition and how that qualifying health condition is defined, but also healthcare providers that are able to certify the need for a leave. And so we know that there may be some issues within these two areas, and we're doing some deep dive right now. The bill really relies heavily on FMLA definitions of these two kind of categories. And so we are trying very hard to talk with as many people as we can to understand where those definitions may fall short, who they're leaving out, either in the category of a type of condition that we would want to cover. We've already, for example, been looking at chemical dependency treatment, making sure that that's adequately covered. We are also, you know, understanding that there may be other types of, I'm gonna just move forward real quickly here to the definition of healthcare provider. We know, for example, you know, doulas are not included in this list currently. There may be others that, again, are particular to maternal and infant health that we want to be thinking about and are open to thinking about changes to this definition to be more inclusive. Again, a lot to think about in the moment, but again, would love folks to, I think Laura sent out or will be sending out a link to the actual bill language. It's kind of quite long, but this is the actual bill language related to healthcare provider. For folks to, you know, take a hard look at you know, to the extent that your communities have already had any experience working with FMLA definitions in these spaces and helping your patients or the folks you're representing get access to leave based on FMLA, it would be important to understand where those things fall short and how we can improve these to make sure that we're recognizing different ways of thinking about care and different ways of thinking about, you know, who's providing care to people and can, you know, will know that they need a leave and would should be eligible for this program. Are there specifics on that coming up, Laura? That okay. You're on mute.
I'm muted. Susan is asking, are we considering adding a midwife?
Yes, I think.
Or a nurse practitioner.
Yes, we could. And Maureen is also, are you still on the call, Maureen?
Yes, Deb, and I was just typing an answer to the question. Okay. Under the term advanced practice registered nurse, nurse midwives and nurse practitioners would be covered under that terminology, but we do need to add midwives because not all midwives are nurses.
Anything else, Laura? You know, Laura and I had a bit of a chat about doulas before this call started, and so also would love some thoughts about kind of how we would think about the universe of doulas and how to incorporate them in this as well, knowing that they're important providers of maternal health care.
Tandi, do you want to ask specifically what you what the question is?
Yeah, sure. So just reading through that language, and I'm thinking about inpatient care, and I think for physical health, like medical conditions, maybe that makes a bit more sense. Mental health, like conditions, inpatient care seems like kind of a high threshold, possibly for someone to meet the need or to be eligible to take paid family medical leave. Not all, I would say, sort of mental health conditions or mental health conditions that require you to take care of somebody also require inpatient sort of care in order for that to happen. And just thinking about, I mean, there are, I think, pieces around accessibility. I don't know the exact details, and I would have to look to some of our partners in the like children's mental health space, thinking about children in particular, but also for adults, there are some access issues already related to getting into inpatient care, even if it is something that someone wants to go to, whether it's residential treatment, hospitalization, etc. That making that kind of be the threshold, and maybe I'm misunderstanding and like making assumptions about how it reads, but I would take that into consideration about what does it mean for someone to have a mental health condition that requires care, and what does that normally look like? Does it mean that they're going into some kind of inpatient care, or does that mean that they just cannot take care of themselves but are still able to remain in the home? Yes, and like Susan just talked about postpartum depression, and then also I want to point out Samira having giving us a broader term than even midwife, a perinatal navigator, to be more inclusive of all the different sort of versions of birth workers that could that do sort of support people's health.
That's super helpful. I'll just say a little bit about the construction of this as it is. So it's either inpatient or continuing treatment. But we are actually, and Maureen might say a little bit more about this, considering just dropping the whole inpatient thing because it just doesn't necessarily make sense anymore the way we think about, and very few people are hospitalized for any significant length of time given the way our healthcare system has evolved. And so we're really thinking about just dropping the whole inpatient thing and maybe getting more specific about what continuing treatment by a healthcare provider looks like or means, because I also think continuing treatment might be challenging in some of the contexts that Atande you're raising as well. So I do think that that would be super helpful to be able to check in with some mental health providers. We have shared this language with NAMI and not gotten a lot of feedback yet. So would love to be thinking about how we can actually check in with some folks that are doing care in these spaces about how to thread this needle in a way that is going to make sure we're getting people are able to access it. For sure.
Thanks, Deb. And sorry, one more thought, just like
to
attach to that. I think I latched onto that and thought about that because I saw the physical and mental condition, but I'm also thinking about like the types of care people seek out and receive when they are undocumented, or when people like seek out care for their undocumented family members. I mean, in general, people who don't have the resources try and limit how much they sort of interact like with expensive healthcare systems, but even more so when you are undocumented and you have to pay for everything. So just thinking about like what that might look like in a family with sort of mixed degrees of documentation, and say they're seeking to take care of an elderly family member that doesn't have documentation or something like that, and what would receiving care for that person look like? Just thinking. I mean, I think exploring that a little bit and figuring out how to make sure the language reflects like that situation as well, for example.
Yeah, that's terrific. Thank you for raising that. I think we have, there's another section of the bill where we allow DEED to sort of de facto, say certain events are serious health events by their nature. And as long as one time it's sort of classified as a serious health condition, then you're done, like that. Pregnancy would be one of those, for example. Like you don't need to be under, like that's been raised, I know, in a number of other contexts, like continuing treatment for pregnancy, like that doesn't necessarily make sense. Anyway, I mean, obviously we want people to be getting prenatal care and so on and so forth, but the point is there are some of these things that on their face make sense, and we're trying to minimize the amount of certifying and recertifying and intersecting with the health system that people have to do in order to qualify for this. But that's an excellent point.
There's a couple of questions here just so you can kind of think about them and respond to them overall in the chat box. Barb Faber was pointing out the idea around treatment to include telemedicine. I think that will be incredibly helpful, obviously, during COVID, but there are so many people who don't have access to healthcare because of distance as well, right? So we know, especially in greater Minnesota and northern Minnesota, you have to leave the state to get prenatal care. And if you have a high-risk pregnancy, that care is incredibly difficult to find. And then the other piece that Summer, maybe you can speak to it if you want to. Do you want to unmute yourself? The question you have about women seeking shelter.
Yeah, I'm just curious about as women are seeking shelter in domestic violence situations, if they feel unsafe about going to work for any reason because their partner knows that that's where they work. Would that qualify? Would that be a qualifying incident? And how do they go about with that language?
Yeah, so I didn't dig into this super deeply because there was limited time, but there's also a whole section of this bill around safety leave, which is a whole separate category and eligible. But yes, I think in terms of a serious health condition, I think we also want to make sure that people are the extent, again, that situations of domestic violence or sexual violence are resulting in physical harm to or mental harm to a person, that they're able to access both buckets of leave potentially. And so would love for you to take a look at the safety leave pieces, and we can follow up on that and make sure for anybody that that piece is also well crafted. It currently ties off of the provisions in Minnesota's sick leave law that requires people who have access to sick leave through their employers have to be allowed to use that sick leave for safety leave. The language that's in this bill really ties off of that language, but would love, again, some good eyes on that to make sure that's meeting the needs of various communities and at the intersection, right, of this own serious health condition or family member serious health condition and that safety leave piece.
Absolutely, that's great. Thank you so much.
Yeah. I lost Laura. Are there more questions in this space, or do you want to move on to the next topic? I think
the others are just additional information. So why don't we, to try to get through some of these other questions, let's do that. And then we'll be able to circle back with what's in the chat.
Yeah, so I hope that this is the first conversation. We only have an hour and a half here, and I love this. This is exactly what I was hoping we would be able to get from this kind of conversation, is these kinds of suggestions and recommendations and mapping on. So again, hopefully this isn't the last of this, and again, can follow up individually or think about whether we need to have another one of these conversations to continue getting the broader input. But the next category was this idea of who's a family member. And as I suggested, we've tried to craft this as broad as possible. But we know that obviously there are all different kinds of families and all different kinds of caregiving relationships that we want to recognize in this legislation and support. And so there are this kind of traditional in clause A here, family member kind of that are biological and legal. But we've also tried to incorporate down here in clauses D and E some other ways of thinking about this. We are working on D and E. I'll just be frank with you. These are not perfect as they are. But the idea with D was really to be thinking about, and we're kind of leaning towards just getting rid of D and concentrating on making E a little better. So E is this idea that that someone says they want to be their caregiver would be eligible for this program. So that's quite expansive. And some of the details of this that we are still discussing and working on is this idea that a healthcare provider would need to certify that relationship. And we're also talking about just abandoning that construction, more so just the person says, I need care from this person, and then that's all there is to it, right? And so we, again, really want to recognize that neighbors, friends, all kinds of people do important caregiving work in our state and in our families. as well as those biological and legal folks in our, that are related to us in those ways. And are, eager to make sure this meets the needs of folks, and obviously critically important just in terms of what kinds of caregiving we're supporting with this bill. And I will say that we've gotten a lot of pushback on these broad definitions, and really looking for support from communities around how important they are. We have gotten lots of, any of you have listened to floor debates, you might imagine some of the kinds of criticisms and pushback we've gotten on this broad idea. So Laura or Atande or whoever.
I was just gonna say that I like where E is going, and that's how families work. I don't know. I just know from experience, sometimes it's like the niece, sometimes it's the nephew, and that, who is the primary caregiver. And I think, I'm speaking from an immigrant lens right now within an immigrant family, but because the way families work, it's so big, it's so extended, and it's kind of all hands on deck kind of piece or effort related to family and family care. This makes a lot of sense to me, and so I want to echo support for keeping it broad and allowing people to define who family is and who's going to take care of them, and identifying who that is.
It's helpful.
Leah, do you want to ask your question, or do you want to, I know she wants to try to circle back to the doula piece.
Oh, okay, sure.
I was just wondering if you could repeat that piece. I'd love to make some of those connections, if that would be helpful.
Yeah, I just, the discussion was really the acknowledgement that we'd like to include doulas, but thinking about how we would do that. Knowing that we're going to get pushback from the Department of Employment and Economic Development that has to certify these relationships. Like, I know Laura and I were talking about, there's a variety of kind of certification programs for doulas. So some of those details about how we would define a doula, I guess, in a way that is, again, as inclusive as we can possibly be, but also anticipating the kind of pushback that we'll get from the state agency folks around being able to kind of define a universe, I guess.
Mm-hmm. Okay, thank you.
Yeah, so if you have thoughts about that, would love to hear those, or think about where we can make some more connections, or
definitely. Yeah, I'll follow up on that. Thanks.
Great. Anything else on family? Laura, showing up?
There are no other chat questions in here. So.
All right. All right, so length of benefits is another issue that I think we wanted to talk about. We know that 24 weeks, even the maximum of like being able to use both buckets fully of leave may not be adequate for some birth parents and infants, but we have done our best to try to allow at least this stacking. I will tell you that we've gotten a ton of pushback from the Chamber of Commerce, even on this level of, I will just share this for context about kind of how these recommendations fit in with other states and the allowed leave under other states. So the kind of standard seems to be moving in the direction of this kind of construction of 12 weeks, and then the 10 weeks here for, this is a kind of a not complicated but kind of a normal vaginal birth, with 10 weeks of medical leave for purposes of health, just normal birth related, giving birth, having a baby kind of requirements, and then the 12 weeks of bonding leave on top of that. And we'll also say for families where there's at least, a second parent available to help with this care, that would be on top of this. So we're getting upwards of 8 to 9 months of potential leave to care for a new child. Obviously, that piece, the health piece, doesn't apply if it's an adoption or a foster situation, but it certainly, again, would relate to the maternal health piece. So we just wanted to have some conversation about this. I will say one other thing I want to flag that's not in the bill now, but is right now the bonding leave is really limited to biological step or foster or adoptive parents. And in California, there's been a proposal to allow, for example, other family members to be able to take leave to care for an infant during the first year, or not just an infant, but that's kind of the context that it's been in. So for example, grandparents often may be caring for an infant during the first year, or an aunt, or anyway, a variety of kinds of folks may be also available and interested and helpful in terms of kind of covering care during that first year of a child's life. So I just throw that out there as something that that did not manage to get passed in California. But it is something that's being discussed, the idea of thinking more broadly about who can provide care to infants or children in that first year of life, and whether that should be restricted to, the biological or legal parents or guardians in that kind of construction. So thoughts about
Deb, sorry, can you there's something about the slide, I don't know if it's where your mouse is, that it's covering the caveat for California. I'm not really.
Oh yeah, I can't, how can I get rid of this at
I
times?
have no idea. Or if you could just read what it says, or like paraphrase what it says, so I understand, so I can understand that
Yeah,
better.
so it just says that these 3 states are in the process of, they've amended their state laws, and those laws are being implemented. So you see these dates here, 2020, 2020, 2021. This slide is, or this chart is from 2019. And at that point, California and New Jersey hadn't implemented those changes quite yet. And New York is not implementing that change until 2021. But I just wanted this to reflect kind of the current legal kind of policy world, even though some of those changes hadn't been implemented yet.
Deb, I apologize while I was away. You already answered this, so just ignore it and we can go on. But is there any data on how these particular communities are using these leaves? Like, whether they're going to the full extent of them or just part of it or what?
Yeah, so one of the reasons that we haven't pushed hard to make this longer, frankly, is because California has had one of the medical leave piece. We have a lot of data from California about how many folks use the medical leave piece. California, you can have up to 52 weeks of paid medical leave. It's the most expansive medical leave program in the country. And yet, on average, again, combining family leave and paid leave is around 22 weeks on average that are used for a combo of medical leave and bonding leave for new moms, birth parents. Obviously, dads tend to use a lot less time, and that is also something we haven't really talked about, and we didn't talk a lot about in the family definition, but we are also trying hard to construct this program in such a way that will make sure that fathers can take advantage of it. We know that pay and higher levels of pay, even among low-wage workers, are associated with more use by dads. And so we do, and maybe I can share, Nora, we can share some of that data off this offline, because I do think it is interesting to see what people do. We also have data from the FMLA survey. The FMLA survey asks if people have pay or partial pay or full pay and no pay, and then it maps their behavior onto that, as well as some of these other aspects of people's lives, like race and income and things like that. So there actually is a fair amount of information. You know, there's obviously huge amounts of information from other countries, but that, you know, often we get laughed off the stage if we bring in other countries into the into the space, you know, yeah, so there is, and I would love to get into it more, and maybe we can have another conversation or another webinar about that, because I think there's a lot of interesting things going on there. But the intersection of the various elements of these programs really make a difference for how they're used, right? I mean, California does have this really expansive, you know, medical leave, but they also have very, you know, not great job protection and not great levels of wage replacement, which they're working on, and they have improved those wage replacement levels. So anyway, it's complicated by the intersection of the different elements of the program and how those come together to create something that people can actually use. So.
Great. It looks like, thank you. Great questions, Nora. And it sounds like lots of people are responding that this is kind of what they were interested in better understanding, is how these different leave options work together to support families. So I believe when I'll go back into the document that you sent that has a summary, but that might be something we want to highlight, is how families can access both types of leave and what we know are the averages. So that will be helpful to send out with people.
Yeah, there's a small percentage of workers that tend to use both types of leave in 1 year. But among those who do, the majority are birth parents, right? So again, and by design in some ways, because for many of the programs, there's like a seamless movement from the health related medical leave eligibility to the bonding leave. So they try to make that kind of seamless for birth parents in particular, moving from that one type of benefit to the other. And so by design, you know, that's probably the most common kind of scenario where a particular worker would use both types of leave, medical leave and family leave, in the same year. But there are definitely cases, you know, and there are definitely lots of things that come up in people's lives, right? Like you could imagine any parent or any of the family caregivers having their own medical condition, and then having a family member have a serious health condition in the same year. And so people kind of combine those in different ways.
Great, thank you. And there are some some offers here in the chat that we'll follow up with you both, Atande for the mental health providers, and Barb, the possibility of talking with MIAC about how tribes might be able to opt into something into this policy, whether or not the state passes it, actually. So we can also talk about that. I'm dreaming. So I know we are at time, but I wanted to just see if there were any last questions for Deb before we wrap up this conversation.
I just want to say how grateful I am for all of you taking the time to dig into this. I am thrilled that we're, you know, digging into the weeds this deeply, and because I really, really, really believe that that is where the important pieces of this legislation and how it works for people live. And I know that it can be challenging, especially in an 80-page bill, it's intimidating as heck. It's intimidating even for the people that have been working on this bill for 6 years to, you know, keep it all in their heads. So I'm really grateful. And again, I hope that this is just the beginning of the conversations. And I know you all are very busy, and I really value your time. But I do believe this bill could be very helpful for many of the communities that we all serve. And so I keeps me up at night wanting to make sure that we're crafting a bill here and passing a bill that's actually going to do what we want it to do, and not just reinforce existing disparities. So
I just want to say I appreciate the research that has gone into this process, and also how this 80 bill got constructed and all of the elements that you had to cover. I think that's very informative. So thank you for that, and thanks for all the work that you all have done on it.
Perfect. Thank you, Nora. All right. Well, with that, I think we will close the meeting. I will, as I said, send out the recording and the materials. We may also have some follow-up questions for you that you might be, if you're willing to distribute, and we'll definitely follow up with those of you who have offered to be a resource in connecting with other constituencies. So thank you, everybody. Have a great day.
Bye.